A single decision. Millions affected. When a U.S. presidential order paused foreign aid in early 2025, it didn't just disrupt supply chains, it turned life-saving medicines into symbols of bureaucracy. Children like 5-year-old Suza Kenyaba, battling malaria in a Congolese clinic, became collateral damage in a political debate. The medication she needed was just 7 miles away, but Trump's freeze had left it trapped in a warehouse, rotting alongside billions in delayed shipments. And this is the part most people miss. The human cost of policy isn't always in the headlines. It's in the quiet tragedies of families who never received what they were promised. Imagine a shipment of anti-malarial drugs worth $190 million, scheduled to arrive by June. Instead, $76 million of it never reached clinics, warehouses, or even ports. Some medicines never left factories. Others sat in customs, their expiration dates ticking down. For Suza, this meant no treatment. For Congo, it meant malaria deaths tripling in her province. But here's where it gets controversial. Was this a necessary streamlining of inefficient aid, or a catastrophic failure of leadership? The U.S. government defended the pause as a step towards smarter foreign assistance. Secretary Marco Rubio claimed no one had died from aid cuts, while critics like Dr. Marcel Yotebieng, an HIV researcher in Congo, argued the freeze destabilized entire health systems. When you cut off medicine for HIV patients, he said, you're not just letting them die, you're creating a generation of drug-resistant viruses that could come back to haunt us all. And that's the question we must ask. Who bears the blame when global health becomes a political chess piece? The fallout was immediate. In Lualaba province, 7-year-old Gilbert Kayambo ran out of HIV medication in February. His mother, Lorraine Kapalanga, begged hospitals for help, but the USAID-funded antiretrovirals were stuck in a warehouse just miles away. By March, Gilbert was dead from complications of untreated HIV and malaria. His story isn't isolated. Over 200 HIV-positive people died in Lualaba alone in the first half of 2025, a 34% spike compared to the previous year. Yet the State Department insists its new future-ready supply chains, including drone technology, will fix these issues. But can innovation replace what's been lost in human lives and trust? The logistical chaos extended beyond Congo. In Sudan, expired food rotted in warehouses. In Kenya, clinics rationed HIV treatments for pregnant women to prevent transmission to newborns. A Lancet study warned that if aid cuts continued, 14 million lives could be lost by 2030. Meanwhile, the Trump administration's DOGE service, led by Elon Musk, labeled USAID a criminal organization and pushed to dismantle it. Is this a bold reformation of foreign aid, or a dangerous dismantling of a lifeline for the world's poorest? By September 2025, some programs resumed, but the damage lingered. Chemonix, the contractor managing USAID's supply chain, sued the government for unpaid invoices and furloughed 750 workers. Local staff were let go. Critical last-mile deliveries to clinics remained frozen. Even after resuming, the system sputtered. In Haut-Katanga, a regional warehouse held 249,000 vials of artesunate, a malaria treatment, in April, enough for 100,000 patients, yet clinics in Lubumbashi still ran out. How do you measure the value of a life when the system fails to deliver? As of July 2025, oversight of USAID's health programs shifted to the State Department, which claims the change streamlined operations. But insiders report a 90% reduction in dedicated staff and a payment process requiring personal approval from senior officials. Programs funding community health workers in Kolwezi were canceled, leaving support groups unable to buy HIV medications. Is this efficiency or negligence? The stories of Suza and Gilbert aren't just tragedies, they're a call to action. As you read this, ask yourself, what does it mean to prioritize American interests when those interests are tied to the health of millions abroad? Share your thoughts below. Do you believe the aid freeze was justified? Or has the U.S. abandoned its moral responsibility to the global community? The answers matter, not just for policy, but for the next child waiting for a vial of medicine that never arrives.